Hi, I'm Dr. Krishna Vyas, plastic and reconstructive surgeon in New York. If you've ever wondered what top surgery actually involves or how it transforms lives, stick around. In this video, I'm going to walk you through exactly what you need to know from the first consultation to the final results. Whether you're considering this for yourself or supporting someone you know or love, this is a complete guide to what happens, how it works, what happens in the consult, before surgery, during surgery, after surgery, and what to expect every step of the way. Top surgery can mean many different things to many different individuals. The most common type of top surgery performed is something called chest masculinization. Chest masculinization is a gender-affirming procedure designed to remove the projecting breast mounds and create a flatter, masculinized chest. For many patients, this is a critical step in aligning their physical body with their gender identity. And while the results are life-changing, it's important to understand that it's a medical journey that involves both physical and emotional preparation. There are a few different surgical techniques we can use for chest masculinization, and this varies among individuals and technique based on your individual tissue characteristics and anatomy, your goals, and your surgeon's recommendations. So we approach chest masculinization surgery in typically one of two ways, either through a double incision approach or a periareolar approach. And the difference depends on how much tissue and skin that needs to be removed on the breast. The double incision approach is ideal for individuals who have larger breast mounds. That involves placing incisions above and below the breast, which allows the surgeon to remove the breast tissue and close in a straight line. If the patients have not as much breast tissue and the nipple and areolas are in good position, then another option is a periareolar approach, which involves creating an incision around the areola and the nipple, preserving it in its native place, and then performing surgery through that approach. So on the day of surgery, you'll arrive to the surgical center, you'll meet with myself, one of our surgeons, and an anesthesiologist. Will help answer any questions that you have, alleviate any of the anxiety that you have. Our goal is to make you feel comfortable during this process. And so I will place some marks on the chest as references. The anesthesiologist will ask about your medical history. They'll place an IV in the arm. You'll walk back to the operating room, lie on a flat table, you'll drift off to sleep, and when you wake up, surgery will be done, and hopefully you'll feel very comfortable. We do specialize in a special nerve technique that kind of blocks the sensation in the chest for post-operative pain control. So typically, patients only need Tylenol and Advil after surgery. This special nerve block technique is using a long-acting nerve anesthetic that is called Exparel. It slowly releases pain medication over the course of 2 to 3 days, so it really helps you feel at ease and comfortable after surgery. We typically don't use any narcotics. That's a specialty of our practice. And we also don't use drains, which are long plastic tubes that come out through the skin. We found that those just aren't very helpful. They don't help prevent bleeding. They cause a lot of discomfort and pain. And so in our practice, we avoid the use of narcotics and we avoid the use of drains for most of our procedures. So one of the most common questions we get for post-surgical recovery is, how long will I have activity restrictions? And activity restrictions are super important because they really help the healing process, and we don't want complications such as bleeding or hematoma. So a hematoma is when you have fluid that appears under the skin. It's not life-threatening, but it does cause contour deformity, can cause a lot of discomfort. And so, ideally all of our goals and activity restrictions are aimed at trying to prevent complications like bleeding or hematoma. Now, the incidence of that is about 1 in 50 to 1 in 100 patients, which is 1 to 2%. It is a rare complication, but it can happen. So after surgery, what we're asking for is no heavy lifting, pushing or pulling more than 5 to 10 pounds or about a gallon of milk for 4 to 6 weeks. Now, the initial recovery phase, you'll have a surgical bra or a surgical garment in place to help with some compression, reduce the swelling. But the main things to help prevent bleeding are no elevated heart rate, no elevated blood pressure, and again, no heavy lifting, pushing, pulling, or strenuous activity, no repetitive motion like an elliptical. I often advise patients, don't have any sudden motions like riding on a subway or a bus, holding a handle, things that can kind of jolt and cause trauma. That can tear a stitch and cause some discomfort and also result in hematoma and bleeding. Don't use an elliptical, don't walk a dog that could pull on a leash suddenly and cause a tear. Any trauma, obviously no concerts, no sporting events, no sexual activity. And so all of these goals are really meant to help prevent the incidence of hematoma or bleeding. Other potential complication is seroma. That's a fluid collection that occurs on the side of the chest. It's sort of like a waterbed of fluid. Not an emergency, but something that we would want to address at the time that you come back for your post-operative visit. That involves numbing the skin, sticking in a needle, sucking out some of the fluid, and then you're done. So quick recovery, you avoid the use of drains, but that is about a 1 in 10 chance, or 10% of the time, there will be something called a seroma or fluid collection. Now scarring has to do with mostly your genetics. So some people form hypertrophic scars, some form keloid scars. It's really up to genetics. We do our best to close the incisions aesthetically and make them beautiful, but a lot of it comes down to your own skin genetic phenotypes and profiles. Emotionally, this surgery can be transformative. Patients often describe feeling more at home in their bodies, more confident in social settings and in self-expression, and more aligned with their true selves. It's not just about physical change, it's about peace of mind, self-expression, and finally being able to live authentically. So if you're considering top surgery or simply want to learn more about your options, we're here to guide you through every step of the journey. Feel free to contact us at 212-427-3982 or visit us online at breastsurgerygroup.com to schedule your consultation.